Dr. Moritz Hempen from Germany. Dr. Hempen is a medical doctor specialized in internal medicine, and he has a master degree of TCM, Traditional Chinese Medicine, from the Technical University in Munich. And since this year, 2025, he's also teaching himself at the Technical University of Munich, TCM. He also is practicing as a physician physician of traditional Chinese medicine in Munich, and he is the president of the SMS, which is one of the major medical acupuncture associations in Germany. They focus a lot on traditional Chinese medicine, but at the same time on science, so it's a very qualified society. And he's also the head of teaching of this society. The topic today is acupuncture in heart disease. Dr. Hempen, I don't see you now. The floor is yours. Is he here?
Yes, I'm here. Yeah, thank you very much.
Welcome.
Thank you very much.
I didn't see the photo before. Welcome. Go ahead.
Thank you. Thank you so much for your warm words. I really appreciate the opportunity to talk about one of my passion topics, actually, which is cardiology and TCM. Yes, I have been working as an internist, combining TCM and internal medicine, especially cardiology, for about 10 years now. And it's really amazing what you can actually accomplish by combining those very beneficial and efficient techniques. I'm not actually sure if this is, oh yeah, this is working perfect. So let's see. Can everybody see the presentation? That's great. Okay. I hope, yeah, okay. I hope this should see everybody. Okay, so as I said, yes, so thank you very much again for giving me the opportunity to talk about this topic. Thanks to all the boards, thanks to the whole board of the ICMART. I'm very glad to be at the next Congress again in France. Very much looking forward to that. So we can see each other in person again. Today I would like to talk about the acupuncture and heart disease. So first of all, if we talk about the heart disease, we need to distinguish between certain conditions. Obviously, there is something called the acute coronary syndrome, or short ACS, which is an emergency condition. And in this condition, obviously, acupuncture has no place, right? So in this condition, we need the Western therapy only. We need probably a heart catheter as fast as possible. We need blood thinning therapy sudden extensive care. Acute coronary syndrome implicates the heart attack and unstable angina. Unstable angina is a condition where a patient would suffer from sudden chest pain or sudden shortness of breath that actually derives from a perfusion issue in the heart vessels. To distinguish is the chronic coronary syndrome, or short CCS. The chronic coronary syndrome is mainly what we know as the stable angina, which is a condition where a patient suffers from chest pain and discomfort in the chest and heart area, but only at a certain condition, only at a certain exercise, only at a certain exercise, for instance, during walking stairs or riding a bike. Behind this is an idea that we see illustrated here. The idea is that we have either a healthy artery or initial plaques, or maybe in the coronary arteries, plaques that actually have to some extent an obstructive value, but are not, as you can see on the very bottom, a near or complete blockage. The near or complete blockage are prone to develop unstable angina or even a heart attack, which would finally result in an acute coronary syndrome that needs intensive Western care. But the first conditions that I actually framed here in a red square are summarized as a chronic coronary syndrome because usually they don't result in an acute situation. Usually they would only result in some discomfort during a certain extent of exercise. So this is actually also in line with the recent guideline published by the European Society of Cardiology in 2024 that considers that the non-acute coronary conditions are the symptomatic patients with reproducible stress-induced angina. That's the key word, the stress-induced angina, or ischemia with epicardial obstructive CAD. So this is one of the plaques that is actually already in the vessel, but haven't yet led to a total obstruction of the vessel. Secondly, the patient with angina or ischemia caused by epicardial vasomotor abnormalities or functional structural microvascular alterations in the absence of epicardial obstructive CAD. So if you, I will go one forward again. So if you see if you look at the first one where it says healthy artery, in this condition, in some patients also suffer from a stress-induced angina pectoris caused by microvascular disease that actually penetrates the muscular heart tissue and is not detectable in a catheter and is also not detectable in a CAT scan. So in this situation, in some cases, the so-called epicardial vessels are free of any obstruction, and still the patient suffers from those very typical pain phenomena. This is again a different illustration to show which patients we are talking about here. It's the first one, the one that is in the middle on the upper part of the picture is where it says stress-induced angina or equivalent with obstructive CAD, or it is a angina phenomenon with not an obstructive CAD. So either way, the patient suffers from pain. This is something that is very important for us if we look at the possibilities with acupuncturists later on. In terms of the Western therapy, what we do is we give anti-ischemic medication, anti-anginal medication, and we give blood thinning medication in a situation where a patient suffers from stress-induced stable angina. There's no need to do a stent implantation, the PCI. This has been a large paradigm shift in the last years. So right now, the main focus in Western medicine is the drug medical therapy for the patient. However, in quite some cases, those medication, they don't result in a total relief of the pain sensations. So there's still need for different techniques. And this is actually one aspect where acupuncture might play a role. So if we look at acupuncture and the chronic coronary syndrome, we need to acknowledge that we are mainly talking about a pain sensation in the chest area. So as we all know, according to Ling Shu and all the Chinese theory behind acupuncture, the pain sensations are mainly caused by either qi stagnation or a blood stasis. So either way, we need to get rid of the stagnant phenomenon. Acupuncture channels that are affected in chest pain sensations are obviously the sinus channels and also the heart channel, which is very important for our treatment options now. and the pericardial channel. The pericardial channel might be even more important than the heart channel. The pericardium channel, according to Chinese theory, leads a lot of blood, whereas the heart channel leads not as much blood, but a lot of qi. Apart from the channel choice, it is also important to have a look at the different point categories that might be useful for us. Also, according to Chinese theory, the luo points and maybe also the qi cleft points are mainly used for pain relief, or at least play a huge role in pain relief. So if we look at points now, we can see that obviously at the heart channel, heart 7 Shenmen point, which is a very important point, very often used, I'm sure also by many of you. It's the yuan source point at this very important channel here. It is used for insomnia and different other issues of the Shen. Apart from the heart 7, which is sort of famous, heart 5 might be even more suitable for us. Why heart 5? Heart 5 is the luo connecting point of this channel. And as I pointed out earlier, the luo points are very important to free the channel from obstructive material, also phlegm and other material that would be stuck within the channel. Another example for this phenomenon is stomach 40, as we all know, at the phlegm point, right? So stomach 40 also is the luo point of the stomach channel. So the luo points are somewhat important points when it comes to stagnant pain in a area where this channel plays a role. So heart 7 and heart 5. Moreover, obviously, pericardial channel, which leads a lot of blood, and here mainly the very famous pericardial 6 point should be used. Pericardial 6 is also quite well investigated so far, has a parasympathetic effect in the brain and leads to a decrease of the heart rate and leads to a relaxation of the muscle tissue that actually also contributes to the obstruction of the heart vessels. So this is obviously a very, very important point that is used in different areas. It is also important here that also according to Chinese theory, pericardial 6 is the luo point of this channel. So again, another luo point which might actually contribute to a pain relieving effect. The conceptual vessel with a randomized 17, which is here located between the nipples on the sternum, is the mu point for the pericardial system, as is the bladder 15, the shu point of the pericardial system. So both of those points are, again, important to address the pericardial function. So if we look into some literature results, we find this very well published paper by Liang Fangrong, who used to be the president of the TCM University of Chengdu. In 2019, he published this very noteworthy paper about acupuncture as an adjunctive therapy for chronic stable angina. And this picture is actually the one I wanted to show you here. So it is also noteworthy because what the colleagues in China did, they randomized 404 patients into 4 groups. So usually 3 groups. In this case, they used 4 groups. So what they did is they used the sham acupuncture group, which we know, which is very common. They used the waiting list group, which is also common. And now not as common, but very clever in my opinion, is they randomized towards a non-affected meridian group and a disease-affected meridian group. In the disease-affected meridian group, So that would we call like the Verum group, they used pericardium 6 and heart 5. They're both lure points of the affected channels. And the non-affected meridian group, they used 2 lung points. As you can see on the picture, only after a very little amount of days, they had a significant effect in a decrease of the frequency of angina attacks. And as you can see, the largest decrease is in the disease-affected meridian group. And the non-affected meridian group and the sham acupuncture group, they didn't differ significantly from each other. Also, the waiting list group obviously had the lowest decrease in angina attacks. So this actually shows not only that acupuncture and Verum acupuncture is somewhat effective, but it also shows that the theory behind the Chinese theory behind the point selection is actually crucial here. So it's not only important to use a real acupuncture point, but it's also important to use the right acupuncture point.
Excuse me, 2 minutes left, please.
Yes. Okay. So hang on. I will show you real quick this picture. This is just for the dosage situation, how many needles are needed. And this review study pointed out that only a moderate amount of needles and a moderate amount of acupuncture sessions would result in the best beneficial effects for the patient. This was published this year, so very recent. This is not as important. This last paper I wanted to show you for the end now. One interesting question is if acupuncture actually has a preventative effect when it comes to heart disease. And this acupuncture published by Hongrong Yen shows that acupuncture indeed in this cohort showed over 10 years in a prospective study showed that over 10 years there was a significant decrease which resulted in a relative risk reduction of 40% if you used acupuncture as opposed if you didn't use acupuncture in patients, and the endpoint was developing heart disease or not. So this is quite remarkable and a very good hint that it is both applicable in pain in acute situations and also as a means for preventing CHD, which is up to date the most important burden for humanity. So to sum it up, acupuncture only for CCS, not for acute situations. Acupuncture seems to be beneficial, especially when used with heart 5 and pericardial 6. And acupuncture might have also a positive effect in primary prevention of coronary heart disease. Thank you very much for your time. I hope you could appreciate it.